Hello friends, I am Dr. Girish Bhalerao, Senior and Chief Orthopedic Consultant and Surgeon here at Mumbai. Today we are going to talk about common problems that affect shoulder joint. Shoulder is a very specialized joint with highest range of motion in our body. Shoulder has a ball and socket configuration just like your hip joint. However, the major striking difference is that this ball is outside the socket. The socket of the shoulder is pretty shallow and the ball actually moves only using it as an axis. So this is a pretty unstable joint as well. In this particular challenge, the joint has so much of instability that the most commonly dislocating or subluxating joint in the body is shoulder. To protect this, it is protected by 4 tendons of a group of muscle. Together they are called rotator cuff group of muscles. These muscles' primary function is to offer stability so that the ball stays within the socket and offers movement. However, being muscle, they also offer direction and your range of motion is guided through rotator cuff. The power to this joint is supplied by a big muscle called deltoid, on which you often take injections. So deltoid and rotator cuff together gives you this configuration. However, there are certain patient age group and patient criteria, like people who are having severe uncontrolled diabetes or a long-standing diabetes, people who are on immunocompression therapies or steroid therapies. These kind of patients may have stiff shoulders. These stiff shoulders, commonly known as frozen shoulders, progress through a group of pathological cascade. Like in the beginning, they may have adhesive capsulitis, which causes stiffness. Inflammatory capsulitis allows your joint to become stiff and decrease the range of motion. As this thing progresses, you can also have subacromial impingements. There can be bony spurs which will impinge onto your rotator cuff and cause stiffness. Progressing further, this rotator cuff can also show tears and can also show instabilities or dislocations. Overuse tendinitis is also a part of this shoulder pathology cascade. Looking into this, if the patient comes in early stages, we can treat the patient with simple medications and some physiotherapy rehabilitation. However, if the thing progresses, we can use advanced technology and advanced modern techniques like intra-articular injections, stem cell therapies, growth factor concentrates and regenerative medicine. But many a times we observe that the patient comes to us in a much more advanced stage where either the rotator cuff has been torn or even has progressed to osteoarthritis. In that situation, we do something called arthroscopic rotator cuff tear repairs, or we can also do labral soft tissue repairs through 4 mm incisions through which a 4 mm camera is passed into your joint and an axis is taken. We have more advanced implants and technology with which we can use bioabsorbable suture anchors with which these torn ligaments and tendons can be resutured back to give you your original anatomy. However, if the joint has progressed to a condition where arthritis has already set in, then we have an option of total shoulder replacement which can be utilized in the form of a conventional total shoulder replacement or a reverse shoulder replacement. Case scenarios where rotator cuff is still healthy and can be salvaged, we would love to offer something called a total shoulder replacement where the ball is replaced by a ball and the socket is replaced by a socket. However, if the rotator cuff is completely damaged and an overhead abduction may not be possible, we then empower the deltoid muscle by offering you something called reverse shoulder replacement, in which the ball is changed to a cup and the cup is changed to a ball. This reverse configuration allows you to have much better range of motion and much better overhead abduction. Whatever the problem is, we are here to offer you the most apt, the most recent advanced technology with minimal invasive and customized techniques. We also employ a blueprint technology where we can plan and customize your joint replacements before you taking to the actual surgical theatre. So friends, if you have any problem related to shoulder, please do connect with us and let us help you get back to your problem. Thank you.